The Department of Health says the intensive care unit utilization rate in the National Capital Region Plus bubble is worrisome as it has reached 70 to 100%. According to Department of Health Undersecretary Maria Rosario Vergere, ICU beds are now fully occupied of COVID-19 patients. It also appears on the projection of DOH faster that COVID-19 cases may continue to rise in the country if stricter quarantine measure will not be implemented. FASTER is an instrument that can be used to forecast future number of infections, confirmed positive cases, deaths, and recoveries.
Projections from FASTER showing that if we reduce the transmission and the reduction of transmission is low, meaning we are not going to impose harder lockdowns or harder measures, 430,000 active cases nationally. We will have that by the end of April. And that will compare to our 105,000 active cases ngayon. 350,000 cases in NCR alone by the end of April.
Undersecretary Vergere adds in a week's time they expect that COVID-19 transmission of variants be reduced. There will also be fewer cases of hospitalization among Filipinos and the healthcare system may recover.
Nakikita po natin na nahihirapan yung sistema natin. We are choking. We are having full capacities in ERs, in ICUs. So gusto ho nating ma-manage ng maayos to. Hindi natin sinasara ang ating pinto, no? This is not cast in stone. Basta ang usapan muna ng higher officials natin, tignan muna natin itong isang linggo na ito. Napaka-critical ng linggong ito, unang-una because of the Holy Week. And we know that there are a lot of religious activities being done during this week. Pangalawa, maraming din po sa ating mga kababayan ang gustong nagbabakasyon kapag ganitong panahon.
The DOH also says it is also possible that ECQ in the country may be extended, but will also depend on its impact on the country's healthcare system capacity.
Yun naman ang napag-agrihan. Meron po tayong gagawing weekly targets for our local governments and of course for the national indicators para makita natin at maging basihan para sa desisyon kung tayo ay magtutuloy pa ng another week o tayo ay magli-lift na. So everything will be flexible, everything will be dynamic, it will be based on a lot of factors, but most importantly, it will be based on the capacity of our health system. Pag nakita na natin na nakakahinga na ang ating mga ospital, pag nakita natin na umaayos na at kaya na ng ating mga ospital, magdidesisyon po tayo.
Aside from the overwhelming of hospitals in NCR because of hospitalization, many healthcare workers have been infected with COVID-19. Based on the DOH's report last March 27, 15,771 healthcare workers have been infected. 82 have succumbed to COVID-19. With this, they are lacking manpower in hospitals. Part of the country's augmentation force in hospitals is to send military men to help healthcare workers.
Ang isa sa rekomendasyon ay yung ating mga military reservists. So Secretary Galvez and Secretary Lorenzana has already committed na yung military reservists are already being mobilized para mabigyan natin ng augmentation for health human resources ang ating mga ospital.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
CGI Free Store. Get what you need, not what you want.